Hi, the purpose of this screencast is to take you through the webfolio, and also it's an opportunity for me to go through the marking criteria, which is really important because that's, as you know, what we're going to be marking you against. The first thing I want to do really is reassure you that a lot of the work that you've already done is going to fit neatly into this webfolio and is also going to count towards the marks that you're getting. So if any of you are panicking at this stage thinking, gosh, I've got a lot to do, I wouldn't. As long as you get your case studies done and you take on board the feedback that you've been given by your group tutors in all of the activities that you've done, then we're nearly there. Okay, so hopefully that'll reassure you. What I want to do is go through each of these learning tabs, and then I'm going to pull up the marking criteria, which you can find yourself. It's on the Blackboard site under the assessment tab. And again, when you're starting to put things in here, it's worth having half an eye on the marking grid because you can see exactly what we're going to be marking each of these sections against. Okay, so the first bit of the webfolio is the introduction here. So most of you hopefully have had a chance to sort of have a little play around. You can take some of these tabs out, you don't have to keep them as they are, and obviously there were the little screencasts right at the start about customising your own webfolio, and conversely you can just leave it and just populate it as it is if you prefer that. So the first bit is really the introduction. Now, one top tip, because a lot of people make this mistake, is that when they come to edit it, they forget to delete all of this. So just remember to take out all of the narrative that we've put in here. Obviously, this is some guidance that we've given you, but it really is very much up to you how you decide to present it. So here, you know, if you think about an introduction, really what we're wanting to get is a sense of you as a person. So what's your name, which department maybe do you work in, what's your scope of practice. Some people like to put an image in, which for us is fantastic because we get to see a face and a name together, so that's really quite nice. But it's just really a brief introduction to the webfolio. You also might want to just put in, if you decided to customise this and take some of these tabs out, you might want to just put a little piece in there just saying how you've laid it out. So the first tab after that is where did you start. So if you remember right back, it must seem a long time ago, but right back at the start of the module you did the situational analysis. We got you to think about your scope of practice, got you to work through, if you remember the Benner practice continuum, where did you think you were at, got you to start and think about your two individual learning outcomes. So again in here, take all of this out, but that's where we would expect to see that. So where did you start and your two individually negotiated learning outcomes. So again, you know, you can cut and paste in the piece of work that we've given. You can attach it as an asset. You might want to have made some amendments to that original piece dependent on the feedback that you got. So not too onerous, and you've already done that really, it's just a case of customising it. Now if we move on to these learning outcomes 1, 2, 3 and 4 are based very much around your case studies. Okay, so be reassured that if you've done really good case studies, they're quite thorough, you've used referencing, we can see how you have developed your thinking and clinical expertise continually, then you're nearly there with this. So in the first learning outcome tab, if we just scroll down, we want to see is it really having that profile of evidence excuse me, that shows that you're clinically competent and demonstrates your ability to perform consistently and reliably. So in essence, this is your 15 case studies that need to go in here, and the signed transcript where it says that you've done 5 where you were observing practice, 5 where you were working with discussion with your mentor about each of the 5 case studies, and then finally the last 5 where you were doing it autonomously and again discussing it afterwards and getting signed off. So basically if you put those in there you're going to pass. However, to get the higher marks in the webfolio itself, you might want to think a little bit about, you know, where did you start, how have you progressed, and how have you shown that you've been able to perform consistently and reliably. So that might just be a very short reflective piece, perhaps a little bit about how you've moved along the Benner continuum, maybe from where you've started to where you're practicing now. We often find that a lot of people, as they move through the 15 case studies, develop become a lot more confident, feel more able to tackle more complex decision-making skills, and that sort of practice and repetition actually builds not only their knowledge set but also their confidence and sometimes their ability to perhaps think about altering their scope of practice or moving on. So it's really thinking about, showing us where you started, showing us where you've finished, and thinking about how you can demonstrate that. So part of that is the 15 case studies, and part of that might just be a really short reflective piece in there. So learning outcome 2, again, is really you can pull on your case studies for this. So one of the college's criteria for an advanced practitioner, which you will all know, is about being able to critically reflect upon non-standard or difficult circumstances and really show that you can demonstrate appropriate judgment and decision-making skills. So what I would suggest that you do with this is not repeat information that you've got in case studies, but you might have 2 or 3 examples where there was a non-standard or difficult circumstance that you were involved in and you had to make a particular decision about or instigate a corrective action. So obviously you might have partly written about that in your case studies, because remember, your case studies, you were focusing on different aspects and you're trying to pick something different in each of them to show that diversity. And here you might want to include a reflection on 2 or 3 of those, and perhaps thinking about how those difficult, challenging circumstances maybe made you think differently when you were presented with the same case again. So again, initially, maybe when you were starting, you had a non-standard or difficult circumstance where you weren't sure what you were doing, and naturally you referred on to somebody else. We would expect that when you're a novice practitioner. As you then move towards becoming more clinically competent and developing that expertise and depth of knowledge, it might be that that experience that you had informed your practice decision later. So you didn't need that intervention, you knew how to tackle it. So try and just think about picking 1 or 2 case studies and pulling them together, really. So again, you don't have to repeat the information. You might want to link in your case studies and just talk around how that has impacted on your practice and how you're able to demonstrate that. Okay, so not too massive, it's just picking out the key things. Learning outcome 3, this one should be really easy to do. Obviously we did the etivity, that was the second etivity that you did around legal, ethical and professional issues. The word count was quite small on that. You do now have the opportunity to expand on that. Those of you that took part in the survey that did part 1 and 2 might want to put something in here. You might want to attach those to sort of demonstrate how and if your knowledge around specific legal aspects has developed. And you also might want to just include a little reflective piece around maybe how undertaking that etivity fairly early on in your course has impacted on how you practice. So again, most of that work is done, just putting it in there and writing a little bit around it. Okay, so if we move on to learning outcome 4, again, refer back to your case studies. So don't want you to repeat the case studies again. Pick 1 or 2 things out in here that you can actually talk about. Now these might be individual patient differences. So if you're a RAD review radiographer, people have talked about cultural issues, maybe psychosocial issues, or support for lesbian, gays, perhaps that kind of thing. And the advice that we give them regarding sexual activity, that kind of stuff. So, it's thinking about what was particularly unusual about a patient. If you're looking at clinical and technical decision making, if you're doing something that is more image based, again, there might be something that is more technology based that has sort of had a big impact on what you're doing. So again, don't repeat everything from your case studies, just pull out 1 or 2. examples show how that's fed forward into your practice and perhaps how that's made you think about how you might work differently. So what's really important here is that 1, 2, 3 and 4 learning outcomes, again mainly covered by the activities that we've done and by your case studies. Really sorry, I meant to actually say in the legal and ethical thing again, if you've got any case studies where a legal and ethical issue came up, either referring on to somebody else because it was outside your knowledge base or scope of practice, then again cross-reference that in there. Right, so if we move on to the next set of tabs down here, these really are around individually negotiated learning outcomes. Now, please don't be confused that there are 3 tabs again. The webfolio has been left for you to customise. If you want to, you can take one of these tabs out. Really all we need is either your individually negotiated learning outcome 1 and 2, or take the individually negotiated assignment tab out. You've only got 2 individually negotiated learning outcomes, one of which will be the assignment. So if you wanted to, you could take either this one out, that one out, or the other, but you should have 2 tabs that show you've got that. If you don't feel confident enough to take a tab out, then just reattach your assignment in here as well as in one of these 2 tabs as well. Okay, so we'll just run through this first one. So in here, obviously I think this is fairly straightforward. We'll assume that your individually negotiated learning outcome 1 is the learning outcome that is not your assignment. So literally what you're going to do is put in the piece of work that you did for that learning outcome and for the activity that was called the individually negotiated learning outcome that was not the assignment, having built on that and taken on board the feedback given to you by your supervisors. If we go on to individually negotiated learning outcome 2, you can either put your assignment in here or attach your assignment in this bit here. But again, you can basically either cut and paste that in or you can attach it as an asset. It really is up to you. Okay, if we go on to the next tab, which is the reflective practice. Now again, you will have probably had a little bit of reflection at the end of each of your case studies. We're not expecting you to repeat that here, otherwise it would be very boring for you to do and very boring for us to read. What we really want here is an overall summary. So it's not a massive piece of work. Some people like to do this quite comprehensively and it's entirely up to you. You might want to talk about which model of reflection you've chosen to use. If you like using Gibbs or Johns, you might want to put that in here. But basically it's a summary and it's a collection of your reflections over the duration of this module. So what have been the key things? That's really what we're looking for. What have been the major aha moments for you? Or the things where you've gone, do you know what, I'm going to really do that differently. They're the things that we're really looking at. So the things that might be like pivotal incidences or critical incidences that have made you really change how you think or practice. Now the next tab, which is the action planning, again right at the start we got you to do an action plan. So thinking about how you're going to tackle all of the module, how you're going to get your case studies. What we're really asking you to do here is start and close that loop. So you obviously started off with a long list of things on your action plan about what you're going to include for each of the different activities and how you were going to manage your time over the duration of the module. We don't particularly want to see that there because that's obviously attached up here where you started in the module. What we want to see now is, having done this module, what still don't you know? Because we expect that as you develop more skills and more knowledge, there are going to be other things that you're going to discover that you don't know. It's almost one of those things, the more you know, the more you realise you actually don't know. So we would expect there to be an action plan in here. That can be in a table format if you want to do that, or it can just be a typed piece. So where are you going to go once you've completed this module, once you've been signed off as clinically competent? How are you going to take your practice forward? Obviously part of being an advanced practitioner is thinking about how you can make an impact on the service, thinking about how you as an individual can carry on your professional development. So again, if you want to put a time plan a timeline or a time planning, saying, these are the things that I would like to do in the future, or there might be things that have come up either in case studies or visits to other places. Oh, sorry about that, where you think, gosh, I need to follow that up afterwards. So put those in there. That really gives us a feel of how you're going to go on, carry on with your professional development. So the final summary of learning, you can take this tab out if you want to, if you've already done quite a comprehensive reflective piece. However, I think as an almost concluding part of the webfolio, really, it's a good idea to write a very short piece in here. So it's not just about the clinical skills that you've developed. Hopefully you'll have developed some academic skills from undertaking this module. So all the things about lit searching, being able to pull together a PowerPoint presentation, and perhaps now thinking about sharing that PowerPoint presentation with others in your department. And thinking as well about how it's maybe made you think differently. So again, if you feel that you've covered that final summary of learning in your reflective practice piece here, don't repeat it here, just take this tab out, or you can even just type in, please refer to reflective practice piece. But again, within that we would expect to see, not only your clinical skill development and being able to demonstrate that you're working as an expert practitioner, but also about your personal and academic development as well. Okay, now references, that again, we've left this in here because some people prefer to list all their references at the end. You really don't have to do that. You can list your references as you're going through. So at the end of each case study, at the end of the reflective practice piece, you might want to have a list of references. That's fine. If that's not appropriate, take the tab out, or just put have referenced throughout the text. Okay, so hopefully that, excuse me, might make you feel a little bit better, in the sense that most of the work that you've already done counts towards the marks for your webfolio, and also that you've not got much more to do. It's really just a case now of getting it in here. And now really, the reason I've done the screencast now is that really you do need to start and put stuff in, because people begin to panic towards the end. It can take you a little bit longer. Some people are quite scared of pebble pads, so tend to avoid it until the last minute, which in my experience really isn't a good idea, because that kind of panicky feeling is not nice. So start and put some stuff into the webfolio now. So just to finish this section off, just bear with me, I'm just going to have to flick through some different screens here. I just want to go through the marking criteria to put your mind at ease. But again, this assessment criteria, marking criteria is what we're going to use when we're marking it. So each of these assessment criteria matches the tabs in your webfolio. So that first tab, Learning Outcome 1, was showing that you produce a profile of evidence that demonstrates your clinical competency. So again, be reassured, they're your case studies, they're your signed off transcript, and maybe a brief reflective piece on the Benner novice to expert practitioner continuum. Learning Outcome 2 was around critically reflecting, so again we mark you. Sorry, I forgot to mention that you will be marked out of 10 for that first learning outcome. For the second learning outcome, again case study related with a narrative piece that's going to pull it all together, so picking out one or two particular case studies and putting a narration around that, again marked out of 10. Critically appraising legal and ethical, so that's your etivity. That's if you did the pre and post test, and maybe cross-referencing to case studies where it's appropriate, and perhaps a little bit of narration around that. Again, it is marked out of 10. And again, individual patient differences. Whoops, excuse me. So looking at ones that are standout cases really, and just talking about those, the things that you had to do where you had to make decisions that were out of the normal range. Okay, so coming on, this bit's important now. The evidence for the individually negotiated learning outcome, that is not your assignment. excuse me, so that's marked out of 20. So again, we are expecting some references to literature in there, and we're expecting it to be more of an academic kind of writing style. And then you will get awarded 10, well, you will be marked out of 10, sorry, for how you present the work in a style and format that's appropriate. So really we're looking for a nice flow in your writing style, that you're referencing correctly, which is really important. Remember, it's the Harvard system, which is the brackets Eddy et al. 2010. It's not the numbered system, which is the Vancouver system. Obviously, you're not going to fail if you use the wrong referencing system, but you will move down the mark. So just really simple things. I don't want to teach you how to suck eggs, but making sure that you do a spell check, that your grammar's good, get somebody to proofread it if you're not sure. Remember, this is M level. So although a lot of the stuff that you will write in your case studies, for example, will be descriptive, because that is the nature of case studies, that's not going to be the M levelness of it. So the M levelness in your case studies comes where you're reflecting and discussing the issues around that case study. So in there we expect a critique, we expect to see literature, we expect to see that evaluation and synthesis of current references and evidence bases. Okay, so if you just bear with me for a minute, just while I click up onto my next screen. So obviously, those of you will have noticed that there were 30 marks missing there. That previous marking sheet that I showed you actually only had it added up to 70. So the rest of the 30 marks come from your individually negotiated assignment. So again, here we're expecting you to synthesize and critically review the literature and present us with a 3,000 word assignment. So again, that part of this was about you undertaking the utility and undertaking the literature search that would underpin this assignment and piece of work. So this bit is marked out of 30. Then overall, as you can see on that marking grid, then that adds up to the mark out of 100. Okay, it's really important as well that you understand that the marks are weighted and that you have to pass the webfolio and the assignment. So the webfolio, it's marked out of 70, the assignment is marked out of 30, but you must pass both of those with a mark with 40%. So we often find that students do very well, perhaps in the webfolio, if their natural writing style is more towards reflective practice, thinking about what they've done. That's a very different writing style to the assignment, which is much more of an academic writing style. So we appreciate that some people might score higher in the webfolio but score lower in the written assignment, or vice versa. Some people are very good at academic writing but aren't very good at doing the reflective practice and showing how they've developed their skills and moved on professionally. But the important message to get over to you at this point is that you must pass both of those elements. Now you can be referred, so you can be referred either in the webfolio and say pass the assignment, or you can pass the assignment and be referred in the webfolio, in which case you would get the chance to resubmit that piece of work. Hopefully this screencast will have been of some use. What I'm hoping to do is put on a webinar, which I don't know if any of you have done those before, but it's an opportunity to join a discussion with me, which is done over the internet, and it allows me to answer any one-to-one questions that you have, and that will focus specifically on the assessment, so around the webfolio and the assignment. And just keep an eye out for the announcement for that, and obviously the instructions how to join a webinar and what time it will be on and what day it will be on will be posted, but it will be during the weekday in an evening. Okay, thank you.